Um, I was looking for a specialty that was highly technical, that answers questions and solves problems. This was really, in my particular personal case, the exact opposite of the kind of work I've been doing in clinical medicine, and I wanted a completely new experience. I was surprised that the amount of patient contact I had in radiology was more than I thought, but really uplifting. It allowed us to diagnose people's problems with certainty, and then to work with the other members of the healthcare team to make sure the patient got the appropriate treatment. There's also many parts of radiology where we're involved in treatment itself, using imaging to guide us. Both treatment of vascular problems or even treatment of cancer and other serious illnesses can be done directly in the radiology department and save patients from having to undergo surgeries in many cases. So I thought it was a huge mix of things that I found satisfying. The ability to use modern technology that was changing constantly, and therefore it was very stimulating. Allowed us to use our knowledge of anatomy and physics to apply the latest technology to patient care, both diagnostic and therapeutic, and yet still have patient contact, but allowed us to get involved with patients at a one-to-one level. It was very satisfying. Well, I'm a sort of a techno freak. I sort of enjoy computers. I enjoy applying them. And some of the things that really the scientists have come up with and radiologists have come up with are quite exciting and stimulating. So I find it very low stress in many respects specialty. Our reading room is very ergonomic. It's very dark and quiet and peaceful. We take time to joke around and have a good time. I liken it to my experience in my childhood as a camp counselor and camper and son of a camp director. We try to create a cabin-like atmosphere in our reading room, although our work is very serious. But it's quiet, it's peaceful. We take the time to answer questions and to explore results, and it's not like I'm in an OR surrounded by people and we're under the gun to get done as quickly as possible. We take as much time as it takes with each study that we do. So it's very relaxing in that respect, but it's also very stimulating. Radiology has sort of been reinvented. Every 3 or 4 years we come up with a new technology and a new way of imaging, and a marked improvement in imaging or useful use of information or information gathering to help patients. So some of the inventions, besides magnetic resonance, which you've heard of, is multi-detector CT scanners, which can scan a patient from head to toe in 15 seconds, freeze the heartbeat and take a good look at the coronary circulation. We can look from inside out. We can look inside your colon. We can look inside your airways, inside your lungs. We can look inside your blood vessels. We can dictate using voice computer-activated dictation and send out a report within minutes of having seen a study with the help of a computer. And that information is available online anywhere in the world. I can take an iPad on vacation with me and look at x-rays sitting on the beach in Venice, Italy. So the technology is amazing. The ability to interact and care for patients is amazing. And it's stimulating and at the same time relaxing. So for a lot of reasons, I find it very satisfying. I think there's a tremendous over-reliance on standardized examination testing. We are in a new age, and I think it's time for medical schools and the medical society to recognize the fact that simple recall of information, which is highly stressed, of content study and content analysis is overemphasized. 100 years ago, maybe even 50 years ago, when information was not available at your fingertips, you had to have it codified in your brain so you could apply it at the bedside. It's not true anymore. There's nothing you can't carry in your pocket that you can't Google within 10 seconds to get the answer to the most intricate kinds of questions. There are radiology teaching sites on the computer. There's all sorts of radiology question and answer sections in the computer, and even Googling it, we can find the answer to any question rather quickly. Why do we value test taking so much when there is such an obvious invention now that allows us to bring content to the bedside easily? It isn't a lack of content that harms patients. There are other things that are far more important that I believe that we need to take a look at. I think integrity and honesty and a certain compulsive nature make for a good doctor. A doctor has to be willing to go the extra mile, and you have to be empathetic to the point that you can put the patient first. The patient must be first. That is what a healthcare worker does, whether it's a nurse, a physician assistant, or whether it's a doctor, resident, intern, whatever. Your primary job is to put another person's welfare and benefit ahead of your own. It doesn't matter if you're tired, it doesn't matter if you're hungry, it doesn't matter if you have a soccer game to get home and see. It doesn't matter that you worked all day. Nothing matters when you're with that patient. Whatever their needs are should come before yours. If you can't make that choice, you shouldn't be in healthcare. And so I'm looking for people that make that choice readily and wholeheartedly, that are honest, that are good teammates, that work hard, that study that are self-motivated learners, and sort of like a good marriage. If you go into a marriage expecting to give more than you are expecting to receive, it will be and both partners are that way, you will have a strong marriage. You should, therefore, I'm looking for residents who are willing to put out a little more than they expect to get back from their fellow residents. They make good teammates. And make no mistake about it, medicine is a team sport. You know, it isn't one doctor doing it by himself. It's a doctor working with a healthcare team, working with students and residents, working with nurses, working with physician assistants, even clerks on the floor, even working with the families. It is, you know, you're just one of many people working together. So you need social skills, the ability to interact, the ability to seek and create cooperative ventures, honesty, integrity. These are the character aspects that you need to be a good physician. It's far more complex than a number and a board score. And I will take an honest, hardworking person any day, male or female, over somebody with a 99 board score, because there's just nothing in the medical literature that correlates resident performance with high board scores. You know, there's just not, it's just an over-reliance on a test because it's easy to obtain. It can be computer graded. I can devote what I feel is appropriate to my family. Putting the patient first is number one, but that said, radiology allows me to really structure my life ideally, to work when I'm able to. We can even work from at home as long as you have a computer, but it allows me to be home. I can be of assistance to my residents on call from my office at home. It doesn't matter anywhere in the world. Once you're not in the CT scanner room, whether you're in the reading room or in your home or in Switzerland or in New Zealand, where radiologists seem to congregate because it's about halfway around the world, you can read an x-ray. And so this really helps to integrate with our personal lives really nicely, because I can be at home having a dinner party and have somebody call me up and say they need help interpreting a study. I can just simply excuse myself, go in my office, sit down and talk to the resident, look at the study, confer together, and give them my answer. So I find that I'm able to devote my time to both my family and my occupation without sacrificing either. Keeping up. Radiology is changing every 2, 3, 4 years as we develop new technologies, and you have to constantly educate yourself. You have to constantly study. You have to go to meetings, and basically, if you don't keep up, you will be out of date and out of touch in a relatively short period of time. However, that said, that is a stimulating aspect. Nothing's more boring than doing the same thing over and over and over again. It's exciting to have completely different experience constantly evolving underneath you. I'm closely involved with both the academic as well as the hospital leadership in creating a radiology department that's modern and cutting edge, as a university teaching center is expected to be. Therefore, Our department is constantly changing, constantly being redesigned so that it creates the kind of results we need for our patients and for our customers, which also include doctors. That you should only select a specialty, whatever that specialty is, because you have a passion for it. You have a passion for imaging or interpretation or working in this manner. You cannot select a residency because you may or may not like whatever lifestyle goes with it, or whatever kind of respect goes with it, or what kind of admiration goes with it. You have to pick something intrinsically that excites your passions for learning, that excites and makes you want to take part in that specialty whether they paid you or not. If you enjoy going to work every day, you will be a success. If you go to work because you like the lifestyle or like the income stream that comes from it, you will not be happy. And ultimately, you will not be good at your specialty if you're not a happy person. You won't be fun to work with, and really, it is a team sport, and if you're unhappy, you affect the entire team. So I would counsel medical students to go with the specialty that excites them intrinsically, whether they, even if they weren't to get paid for it, that would be the specialty they'd choose. If, let's say, all we got is for the rest of our lives was room and board for picking a specialty, then pick that specialty that excites your passion, and you will be a success at it, and you will make whatever you need to make to be happy, but you will enjoy going to work every day, and that's incalculable advantage over anything else.